Hey guys, good morning. We're having a little bit of technical difficulties, so I'm going to switch things up. I'm going to do science right now. I apologize for technical difficulties, but if we get the internet, the Wi-Fi back up, we will do math as soon as it comes up. But like I said, I'm going to do some science first, so bear with us today. So today for science, we're going to look at, we did finish up body systems the other day. So what we're going to do today is look at health with disease prevention. Okay, so we're going to go ahead and read here. It said chronic diseases are the leading cause of death and disability in the US and among the most costly and preventable. And it says public health, the practice preventing disease and promoting health, effectively targets environmental factors and health behaviors that continue to be chronic conditions. The health risk factors of physical inactivity, tobacco use and exposure, poor nutrition are leading causes of chronic diseases. With even a small reduction to the prevalence of chronic disease, the combined health and productivity cost savings of prevention leads to a positive return on investment within a short time. So it talks about the biggest health risks we face, and it says physical inactivity, tobacco use, and exposure, poor nutrition. Those are the three leading causes that cause chronic diseases in our country. So here's some of the facts. It says almost 1 out of every 2 US adults, that's 107 million people, report having at least one of 6 chronic illnesses. So cardiovascular disease, which is heart disease, cancer, chronic obstructive pulmonary disease, asthma, diabetes, arthritis. 7 out of 10 deaths among Americans each year from chronic diseases. Heart disease and stroke account for more than 50% of all yearly deaths. Diabetes is the leading cause of kidney failure, non-injury, lower limb amputation, blindness among 20 to 74-year-olds. And it says about 13.6 million adults have been diagnosed with COVID, and an equal number remain undiagnosed. And 1 in 3 US adults, that's 63 million people, have hypertension and blood pressure. Hey, Melody? Okay, have hypertension. Nearly 70% of the first heart attacks and 70% of first strokes occur in people with hypertension. So the economic cost. Obesity, which can lead to heart disease, type 2, diabetes, and cancer, costs the U.S. $147 billion annually and $208. By 2030, medical costs associated with obesity are expected to increase by at least $48 billion annually, with annual loss and economic productivity totaling $390 billion to $580 billion. Excuse me. Excuse me, the internet looks like it's coming in and out. So obesity, which can lead to heart disease, stroke. Oh, excuse me, I just did that. From 2000 to 2004, smoking cost the U.S. about $193 billion and nearly $96 billion direct medical costs and $97 billion lost productivity. Smoking caused lung disease such as COVID, cancer, heart disease, and stroke. Okay. The 5 most costly and preventable chronic conditions in the U.S. cost nearly $347 billion, or nearly 30% of the total health spending in 2010. Okay. So heart conditions cost our country over $107 billion, and basically it costs the workforce $95 billion. Cancer costs us about $82 billion, and in the workforce, that's nearly $135 billion. COVID and asthma are nearly $64 billion. That's over 14 billion in the workforce. Diabetes is 51 billion, and a lost productivity cost is 69 billion. Hypertension, high blood pressure, nearly 43 billion to us, and 25 billion in workforce. So lost productivity costs. That means people can't work because of this disease, and their company's losing money. Okay. Or maybe they're out on sick leave or something like that. So those are pretty staggering figures. It says effective public health interventions and policy that targets chronic diseases lead to a healthier population with lower healthcare spending, less school and workplace absenteeism, increased economic productivity, and improved quality of life. By investing in prevention and treatment of the most common chronic diseases, the U.S. could decrease treatment costs by 218 billion per year and reduce the economic impact of disease by 1.1 trillion annually. Data supports investment in prevention. So if we were able to do some of those preventative things, if we got more exercise, use less tobacco, and ate better, it's saying we could save almost $1.1 trillion annually. That says these things. By improving preventive screening and implementing programs that reduce risk factors, the U.S. could save 26 billion in lost productivity costs from collateral colon cancer deaths by 2020. Okay, for every $1 invested in the Truth anti-smoking campaign, the U.S. saved more than $6.80. The Truth campaign decreased youth smoking by 22% from 1999 to 2002 and averted almost $2 billion in future healthcare costs. Every $1 spent on evidence-based programs that increase physical activity, improve nutrition, prevent tobacco use saves $560 in health spending within 5 years and up to $620 within 10 years. So every $1 spent on tobacco cessation programs, the average return is $1.26, excuse me. In 1 year, the U.S. could save more than $711 million. Every $1 spent on workplace wellness decreases medical costs by $3.27 and increases productivity within absentee costs by about $2.37. So making all workplaces smoke-free would save about 60 million direct medical costs, generate about 1.3 million new quitters in 1 year, and prevent about 1,500 heart attacks and 350 strokes. Okay, remember this is from 2010, you guys. So now all workplaces are smoke-free. Okay. And this is from the Center for Disease Control, and this is, they pick one state, Minnesota. And it says, and this is from 2008, so this study's a little bit old, but I'm sure the figures are probably pretty similar. It says chronic disease such as heart disease, stroke, cancer, and diabetes are among the most prevalent, costly, and preventable of all health problems. Leading to a healthy lifestyle, avoiding tobacco, being physically active, and eating well greatly reduces a person's risk for developing chronic diseases. Access to high quality and affordable prevention measures, including screening and appropriate follow-up, are essential steps in saving lives, reducing disability, and lowering costs for medical care. Okay, now we're going to look at heart disease and stroke. Heart disease and stroke are the first and third leading causes of death in the United States and the most common cardiovascular disease. That means heart disease. Heart disease accounted for 21% of deaths in Minnesota in 2005, while stroke caused 6%. So that's 27% of deaths in Minnesota in that year were from heart disease and stroke. In 2007, 21% of adults in Minnesota reported having high blood pressure, hypertension, and 32 of those screened reported having high blood cholesterol, which puts them at greater risk for developing heart disease and stroke. Okay, let's look at cancer now. Cancer is the second leading cause of death in the United States, accounting for almost 1 in every 4 deaths. 24% of all deaths in Minnesota in 2005 are due to cancer. The American Cancer Society estimates 25,000 new cases of cancer were diagnosed in Minnesota in 2007, including 2,650 new cases of collateral cancer and 3,204 new cases of breast cancer in women. Okay. So cancer obviously is another one, but in diabetes. In 2005, diabetes was the sixth leading cause of death in the U.S., likely to be unreported as a cause of death the risk of death among people with diabetes about twice that of people without diabetes in a similar age. So it said 12,058 adults in Minnesota died from diabetes in 2005. In 2007, 6% of adults in Minnesota reported being diagnosed with non-pregnancy related diabetes. And arthritis is the most common cause of disability in the US, affecting more than 46 million Americans. In 2007, 23% of adults in Minnesota reported being diagnosed with arthritis. So this compares the state of Minnesota to the US. So heart disease in 2005, 141,000. This is per thousand. So you can see the US is a little bit higher in most of these. So it's heart disease, cancer, stroke, respiratory disease, or unrelated injuries. Okay, so these talk about risk factors and preventive services. So tobacco use is the single most preventable cause of death and disease in the United States. Each year, an estimated 438,000 people in the U.S. die prematurely from smoking or exposure to secondhand smoke. Another 8.6 million have a serious illness caused by smoking. For every person who dies from smoking, 20 more people suffer from at least one serious tobacco-related illness. In 2017, 17% of adults in Minnesota reported being current smokers. Then we have nutrition. So we have physical activity and overweight obesity. So it says in the past 30 years, the prevalence of overweight and obesity has increased sharply for both adults and children. Physical inactivity and unhealthy eating contribute to overweight and obesity and a number of chronic diseases, including some cancers, heart disease, and diabetes. So it says in 2007, 62% of adults in Minnesota are overweight or obese based on self-reported height and weight. So that's more than half. It says 81% of adults in Minnesota consume fewer than 5 fruits and vegetables per day, and half of them were not engaged in the right amount of exercise. Just as early detection, it says mammogram as a screening method has been shown to reduce mortality due to breast cancer by approximately 20 to 25% over 10 years among women aged 40 and over. It says in 2006, almost 20% of women in Minnesota 40 years and older report not having a mammogram in the last 2 years. And up to 60% of deaths from cancer could be prevented. Persons aged 50 and older were screened regularly. Cancer can be prevented by removing precancerous polyps and abnormal growths, which can be identified during fecal blood tests, sigmoidoscopy, or colonoscopy. In 2006, among adults in Minnesota aged 50 or older, 32% said they never had any of these procedures, and 76% not having a blood fecal test in the past 2 years. So with the U.S. healthcare system changing rapidly, healthcare plans, health insurance need to ensure that all Americans have access to affordable, high-quality preventive service. It says in 2007, 10% of adults aged 18 to 64 having no healthcare coverage. And you guys know that's a huge problem in our country. And this just talks about basically people that are overweight consume. It just compares Minnesota to the United States. And all these things are preventable. You know, overweight and obesity, it could be better nutrition, it could be exercise. Everyone can eat more fruits and vegetables. You can do a little more physical activity. You can quit smoking. All that would reduce the blood pressure. Eating better will reduce your cholesterol. Healthcare is something that's a tricky one because not everyone has access to healthcare. And if you don't have healthcare, you're not going to be able to get any of these tests. So healthcare is a big issue too. Okay. So these are the questions to go along with it. You can just go back up and answer these from that reading. And if you get stuck, all the answers are right here. Okay. So I'm going to start reading in about 15 minutes. So we'll see about the end. Let's see if we can get math towards the end today at 11 o'clock. So thanks, and I'll see you guys in a little bit. Bye.